So, Dr. Ann Stapleton, it's so great to see you. How are you doing today?
Good. It's great to see you also, Dr. Noel.
Yeah. Well, we've known each other for quite some time, and thank you for taking the time to talk about spinal decompression at home. And before we talk about that, I just want to ask a little bit more about you, your practice, how long you've been practicing, where you are, that sort of thing, just to kind of give everybody else an idea of what your specialty is, and how long you've been doing this as well, and the type of practice you are, because you are a chiropractic neurologist.
Yes, I am. Yes. So I was practicing in Pennsylvania about 36 years and did traditional chiropractic as well as chiropractic neurology. And recently closed that practice and moved to Albuquerque, New Mexico, and joined another chiropractic neurologist's practice. So still in the process of getting that going at the moment because
Yeah,
it's
and
new.
how long have you been in practice since the very beginning?
36 years.
36 years. Okay,
Yeah.
wow, that's great.
Yeah.
That's a
Yeah.
lot of experience.
A lot of years. Yes, it
Yeah,
is.
absolutely. And so a lot of people don't know that chiropractic neurology exists, but that is a specialty in the field of chiropractic where the focus is on um, brain rehabilitation, neuro rehabilitation. So, where we address the brain and the body as a whole, but look at it through the lens of the brain and see, are there anything that we can do to optimize brain function, restore optimal balance? And because it's not just for the brain controls everything, including the body. So I absolutely love functional neurology is what it's, I think, recognized as the most, but it is a specialty within the chiropractic field.
Right.
So, and that's how we met.
Correct. That is how we
Yeah,
met.
that's how we
Yep.
met.
Yep.
Um, and so I'm in Georgia, you're in New Mexico now,
Yes.
and you've been using the in-home spinal decompression bench. It's something that just came out just a couple months ago, and you're one of the first people to get one. And I just wanted to have this time to kind of ask some questions because obviously I know why I use mine, and I created one, and and I have these things available in the office, but I still needed something at home, and I'd like to hear from you for one, how has your experience been using it, but also what was the draw for you to get something at home versus, going to the clinic?
Um, okay. I got my table in the early part of May, I believe, and I've had some spinal issues that I didn't know that I actually had. I mean, I've been getting regular chiropractic every 2 weeks for over 30 years and thought I had some things under control. I've had some issues with right neck, right arm, things like that, but they usually would resolve in some rib things, lower rib. But then with all the moving and the stress and the things that were going on, I ended up developing symptoms on the left side. Got a full spine MRI, and I have a lot of issues in my entire spine. I have 3 disc bulges. I have spinal stenosis in my neck. I've got issues in my lower thoracic and in my lumbar spine as well. Um, so, I did some physical therapy for some of the symptoms back in like December, January. Um, Things were improving. Then we moved, and I still was having a lot of symptoms. The neck things improved, but then it's settled into my right lower back. Um, and it was extremely painful every day, all the time. I get a anterior right rib. I get a little bit of a lower rib, where it just seems like it goes into this seize that I cannot get rid of. So I was having all of that. It had ratcheted down in intensity some in the lower back. Oh, and by the way, I also had gotten the in-home spine care cervical traction unit back in November, I think, to deal with my neck stuff. So that did help. But then still having the right low back stuff that I wasn't seeming to be able to resolve and wasn't used to having pain every day, all the time. Got a lot worse when I would lay down in bed. So I ordered the table because I was thinking, well, there's things going on in the lower thoracic lumbar spine. I needed to try something to get that under control. It's got the
Mhm.
table, put it together, started doing it nice and gently and lowly and slowly, like you had suggested. And I started to see that because I have my right shoulders forward, my left pelvis tends to go posterior.
Mhm.
So it seemed to help regulate that in a way that I wasn't able to do with all the exercising and walking that I do. So I think the traction started to help that resolve. And I've had, I still have some pain, but nothing, it's like a 1 or 2 on the pain scale compared to 15 out of 10.
Mhm.
So it's been extremely helpful. I've also put my cervical traction unit on the lumbar traction table, and I use the both of them at the same time now. And I do different stretches. I used to not be able to reach my arms behind me or up without getting a really terrible spasm in the left lower thoracic area. That seemed to all start to improve as I was trying to do it almost every day. That got much better. The spasm don't happen, but I just last week hurt my rib. So everything's kind of gotten fired up again. Um, and I haven't been able to get it completely resolved yet with the lumbar traction, but I feel confident that I will be able to do that.
Yeah.
So
And I'm glad you mentioned all that because, I think, and we're used to it as clinicians that we work with patients and they make progress and then they regress a little bit and then they make progress again. Like it's not always just a straight line.
correct.
Um, I actually experienced that when made the very first uh, inversion belt, which at the time we didn't have the bench we have now because that just came out 2 months ago. But
Hmm.
what we had initially was a belt that went with an inversion table, which is very limiting because obviously not everybody can invert.
Right.
But I remember doing that, and I had severe low back pain for so many years. And I decided, I'm going to give this a fair try. I decided for 90 days, I'm going to commit to decompressing as often as possible. And I did almost every day. And it doesn't necessarily have to be every day for everybody, but that's what I did. And I decided whether I feel symptom improvement or not, I committed to 90 days.
Hmm.
And by the end of the 90 days, I was feeling the best I had felt in so many years. But I can tell you, like you said, in your experience, within those 90 days, there were days where I was in so much pain. And even after decompressing or stretching my spine, I wasn't feeling the relief that I was hoping for. And this is back when there was one, right? I had one prototype and nothing else. And
Yes.
I had made a decision. I said, I'm gonna give this a full try for 3 full months. And after 3 months, it was absolutely amazing. But I had to get through some periods where it was worse at times, it was better at other times. It was kind of all over the place. I think the fact that you had such a dramatic result right off the start is really a great indicator that, well, this is going to work. But there are other factors too. I mean, it's important to get adjusted. It doesn't replace the chiropractor, and there are times where if your spine is not well aligned and you decompress it, you're not going to get as much relief as if you had an adjustment first and then decompress it. You want your spine aligned,
I
and I know you know that, but I say that for everybody else.
yes.
And then there's inflammatory situations where certain foods we eat. So if we eat a diet that's high in sugar and inflammatory foods, then naturally inflammation is going to be higher. I mean, I know of some people, some patients that I've seen for 15 plus years, um, who got the most amount of relief after 15 years of me telling them, you got to change your diet, take the sugars out, take the grains out, take all that inflammation out. And
Yep.
finally, after 15 years of hearing it, they do it and they're like, oh my goodness, I feel so much better.
Yeah. No, I mean, I 100% agree with you. And I think that what I've seen as I've gotten older is the inflammation targets the weak spots in my body, right?
Yeah.
So I have my spots now that I probably twofold. I couldn't recognize it years ago, and maybe it didn't show up the same way as it's showing up now that I'm older. And I also think that stress drives a train too, because I think some of this is neurologic, because it is an actual lockdown. Yes, there's the injury. I hit the rib in the front on Thursday, and I thought I had just bruised it. I think that was what it was. But then Sunday, I decided to do a little speed walking when I was doing my 4 mile walk, and I just did too much. And then I think that it locked my pelvis down, which then locks the diaphragm and then the rib. So I'm in a lock right now. It is improving, but it hurts. And
Yeah.
I did just get adjusted this morning. So I'm hoping that will, um, because if I put my right shoulder forward, or if I put my right shoulder backward, since it's in that kind of subtle position of always forward with the pelvis back, if I physically move my right shoulder back and bring my pelvis forward, like some people would never even notice that little
Mhm.
pattern, but if I put the shoulder back and the pelvis forward, the pain in the rib is completely gone.
Yeah. Yeah.
So anyway, yeah,
Well, and that's what happens with the body. You had an injury, but when the body perceives either an area that's injured, damaged, or you have an injury, there is always that's the muscles is what we use to protect. We
right.
want to lock down to prevent further injury. It's a protective mechanism.
Yeah,
And sometimes that'll linger, it could be that the problem is gone, but the actual lockdown of your stabilizing musculature is persisting. Sometimes that happens too.
yeah,
And those are the situations where people have muscle release work done and they feel, oh, problem's completely gone. Well, yeah, that's what happened. You
right.
compensated in a way, locked in, and the problem went away. The original cause is gone, but the secondary response remains. That happens
Yeah,
oftentimes too. Yeah.
yes. Yep. Well,
That,
like I said,
yeah.
it's committing. It's committing to doing the things that you know are going to be helpful and
Hmm.
giving it a long enough time to actually make those changes. And
Yeah.
as we all know, sometimes with patients, it's hard, but if they had something at home, I think that that is key, right? They're not going to go to the chiropractor 5 days a week. That wouldn't be a good thing for anyone. So if you can do the lumbar traction at home, then it's going to allow you to be more consistent with doing that treatment.
Yeah,
So,
thank you for bringing that up. And because I have three spinal decompression tables in my office.
mm,
So we still do it. And
yeah,
there is a phase or a time where patients need to be in the office under care.
right.
But there's also a time where patients can get a whole lot better if they have a home solution that they can use every day or more than. And that's the thing is there are many cases that require a high frequency of treatment,
Hmm.
and not everybody can commit to that level of frequency,
Right.
in an office. And the other thing too that I think is important is that um, by the end of the day, our discs dehydrate significantly through the day.
Yep.
So we've got to make sure that we're sleeping long enough for those discs to recover,
Right.
but they are worse at the end of the day than they are in the beginning of the day. So if we get to decompress the spine later in the day, I think there's a tremendous advantage there. But then again, I mean, we still see patients here in the office in the morning and they're getting better. It's not to say that you're not going to make any progress if you don't do it at night before bed, but that is just a nice thing to have available at home to really further optimize that healing curve.
Yep,
So,
I completely agree. And also having, knowing, getting that knowledge to the patient that it may be more beneficial. Try doing it before you go to bed. Um,
Mhm.
and I think that, oftentimes I did it in the morning just because of the way my schedule was, but I think that it might be better, especially right now since I heard it, to do some later on in the evening treatments.
Yeah. And there's a lot of different types of injuries. There are some, and that's why it's so important, to see a trained clinician.
Yes.
I think chiropractors are great, but some people will see a physician of another type of physician that may do a perfectly great job
Right.
at assessing, maybe doing some films, making sure that this is an appropriate option for them.
Hmm.
If they've got um, instability in their spine, well, then that might not be the best. It's not the best option, right? Because if your
Right.
spine's not stable, we're not going to stretch it.
Right.
We need to strengthen and stabilize it.
Yeah.
And that's really kind of one of the things too that this bench is helping with is in some situations, and actually in a lot of situations, it's just more beneficial if we can do a strengthening, stabilizing program along with the decompression or right after.
Hmm.
And it doesn't have to be, the exercise that we recommend. There's lots of other exercises out there, but it's nice before you even get up off the table, even if you do a few minutes, it could be very short. Just engage those deep stabilizers before getting up.
Yep.
Um, I think that's something that's often forgotten, but that
Yep.
can be very beneficial.
Yeah,
Yeah.
I agree. I mean, I think I told you when I saw you not too long ago that I was doing some pelvic tilting
Hmm.
while I was in traction. So I would pelvic tilt a little bit and then I would stretch my arms up. Now I couldn't have done that when I first got the table, but as I've used the table more and have had it a couple months, I do try to make sure that I do the pelvic tilting so that I'm kind of working some of those deep stabilizers as well. Um,
That's
but
great.
yeah.
Well, thank you for taking the time. And I want to make sure too that I mentioned that people can find you if they're in the New Mexico, Albuquerque
Yes.
area.
Yes.
They can find you online. And can you remind me what's the best way for them to find you?
I think that I will be soon that they're redoing the website for Southwest Brain Performance Center, so
Okay.
I should be able to be found there now.
Okay.
And if it's not fully operational, they still can call Southwest Brain Performance Center
Perfect.
and ask to schedule with me there.
Okay.
Yeah.
Outstanding. Well, thank
Okay.
you so much for your time. I appreciate you and your expertise and your friendship.
Yeah, me too. Same.
Well, have an awesome day.
Okay, you too.